The use of big data is becoming more and more prevalent in real-world research. In this study, we used the German statutory health insurance database claims to assess the burden of illness in individuals initiating intermittent catheterization.
My name is Jimena Goldstine, and I am employed by Hollister Incorporated.
Intermittent catheterization, or IC, is used to drain urine from the bladder that is not emptying adequately. The European Association of Urology states that intermittent catheterization is the gold standard for the management of neurogenic lower urinary tract dysfunction. While the correct use of IC and strict compliance with hygiene instructions should avoid negative effects, a major complication with catheterization is the increased risk of developing urinary tract infection, or UTIs. The objective of the study was to evaluate the standard of care and burden of illness in German individuals who perform intermittent catheterization. The study provides real-world evidence on IC use, which may be used to derive recommendations for improvement of care in this patient cohort. Our study used the German statutory health insurance claims data system, which is representative for the German population in terms of age and sex and is widely used for real-world evaluation. The index period is the day of initial intermittent catheter prescription and includes patients with continuous insurance coverage and complete medical records between January of 2013 and December of 2015. Any individual with prescriptions prior to the index were excluded from the analysis. Baseline is 12 months prior to index, and there was 2 follow-up periods, one year and 2 years post-index. The total population for analysis is 1,100. This was after excluding individuals for having used prior IC, for having had multiple prescriptions of IC, and for having unspecified coding in the database. The total population was evenly split between males and females with an average age of 57 years old. 47% of the population had indications of urologic diseases, while the remaining 53% had indications of a neurogenic bladder dysfunction, which include conditions such as spinal cord injury and multiple sclerosis. Our findings suggest that even prior to the initial intermittent catheter prescription, individuals are experiencing a high burden of illness. This is notable in the fact that at pre-index, these dark gray bars, you see a high burden of UTI and antibiotic prescription, as well as prophylactic prescription. Prior to index, that's prior to the first intermittent catheter prescription, 61% of the individuals are experiencing UTI and 71% are being prescribed antibiotics. Now, while by follow-up 2, the prevalence is a little lower, there's still a high burden, with 50% of the individuals still experiencing UTIs. This translates to a high cost to the healthcare system. These costs range from pre-index of 18,000 euros approximately, peaking to approximately 22,000 euros in that first follow-up period, and then tapering down just a bit at 20,000 euros by the second follow-up period. We can see that aids and remedies were the costs that increased the most, while inpatient costs decreased over time. Medication, outpatient, and sick pay costs remain consistent. Using data from the German statutory health insurance claims data system, we were able to see that intermittent catheter users begin their journey with a high burden of illness, even prior to their first prescription. This is evident by the fact that 61% of these users had evidence of UTI even prior to their first prescription. This high burden of illness is also reflected in the total healthcare costs, with approximately 20,000 euros per year in healthcare spend. The cost and some clinical complications did taper down by the second follow-up, which suggests that individuals using intermittent catheters are finding ways to successfully manage their clinical complications. Our analysis describes the burden of illness of intermittent catheter users and demonstrates that this burden begins even before the first prescription. This suggests that there may be a gap in care and bladder management and that there's a need for improvement and further studies in this patient cohort. These patients begin their journey with a high burden of illness, and so it's important that they have access to specific products and individual therapies that manage their health condition and seek to improve their quality of life. This slide describes the ethical considerations for the study as well as the conflict of interest of the authors. Thank you.